Good morning. I'm with Ed Harrison and Bernard Harris with Pikes Peak Strategic Group. Good morning, guys.
Good morning, Dan.
How you doing, Bernard?
Good. Good morning, both of you.
Hey, I wanted to ask some questions about the Affordable Care Act. We are coming up to a new enrollment period, and it's going to be November 15th of 2014, and I think the open enrollment ends on February 15th. And I wanted to ask you guys some questions about coverage, and then maybe talk a little bit about some of the deductibles and things like that that the ACA doesn't cover.
Okay. Do you want me to start off, Bernard?
Yes, go ahead.
Yeah.
The Affordable Care Act now going into its second year, also known as Obamacare, but it's officially the Affordable Care Act. And I guess it has had some success as of last year, depending on who you talk with. But there have been, some great things happening with this program. And we as Ameriplan salespeople, we're here to complement the law, and that's the Affordable Care Act. And they've got 10 essential things that must be covered in the Affordable Care Act. But what it does not cover, but let's talk a little about what it does cover, because that's important for families to know.
Right.
Emergency services, ambulatory patients, outpatients, maternity, hospitalization. I think that mental health thing is very important. Laboratory, pediatric services for children under the age of 18. That's important.
Mm-hmm.
So the Affordable Care Act has a lot of great things that can help our fellow Americans. But what Bernard and I like to do with our business, and that's the Pikes Peak Strategic Group, the Ameriplan Corporation, is complement this law and this healthcare program that's here to help people. And we're here to help people and families stay healthy. And in particular, I want to point out the fact that the Affordable Care Act does not cover adult dental or vision, or even chiropractic services. In particular, the adult dental is quite critical. Those of you who have been to or had the pleasure to go to a dentist lately knows how expensive it is to go to a dentist. So when Bernard and I are talking with people who are considering the Affordable Care Act, we sort of direct them to the state site. We're not licensed insurance. We can't do anything, but from an educational point of view, we ask them they should go to the site. But before they do that, I like to show them our dental program, because I'd like to sign them up on the dental program before they go into the site, because there are insurance companies there that are pitching their dental programs as well. But we feel that we have one of the premier discount dental programs in the country for $19.95 for a whole household, which includes a vision program, which the ACA does not cover for adults, and our great chiropractic services. So what we try to do week in and week out, Dan, is to educate the public on the Affordable Care Act, and it does have a lot of good points. It helps save people money. There's a lot of different subsidies you can get depending on your income level. But what we try to do is get people to take a look at our fabulous dental program, and then direct them, especially here in the state of Colorado, to the state sign-up system. And they can do that on their own. Mm-hmm. Through their website, and probably on the phone too. So there's a lot of information out there. But our dental program is by far one of the best in the country, and we can save people money day after day, year after year, if we can get them to use it. So that's a little about how we can assist people with the Affordable Care Act.
That's a good comparison there, and some good information. I wanted to ask Bernard that I'm still a little confused, and I think a lot of other folks are confused from what I'm reading about the Affordable Care Act, that I think people seem to think that it covers everything. Once you get that insurance, you don't have to spend another dime. There's no deductibles. There's nothing else that you have to do. Is that 100% true?
It absolutely is not, and it is a national misconception. In fact, I'll tell you the good part. The Affordable Care Act allows all Americans equal health care across our great nation. However, it does not relieve you of the responsibility for paying for that professional care. And it's a proven fact that a lot of Americans have opted for a high deductible to get their monthly premiums down with the Affordable Care Act. And most folks have settled on a $5,000 deductible. And what they don't know is your insurance does not kick in with regard to payment. You still get the service, but you still have to pay before the insurance company pays their portion.
So
most of those plans, you have to pay that upfront deductible, and you're still responsible for your share on the back end.
So the deductible, if you choose a lower, I guess a bronze plan in the Affordable Care Act, the deductible you would have to pay. Say if you ended up in the hospital and you had a $20,000 bill, well, you would have to pay the first $5,000. Is that true?
That's absolutely true.
Okay, and then the insurance would kick in for the remaining 15 in a simplistic term, of course, because I'm sure there's a lot of other details. But that's basically how it works, right?
The insurance would kick in for, say, if it's a 70-30 plan, they would pay their 70% minus the deductible, and then you still have your 30 or maybe even your 25% left of that bill on the back end, and it goes per calendar year.
So every year this clock starts ticking, basically.
There you go. So it starts over new with each new period, and I am almost 100% sure that that is per medical issue.
Okay. So if you're a multiple medical issue person, then you could be in for some substantial expenses.
Absolutely, and this is where the Ameriplan Corporation, in concert with the Pikes Peak Strategic Group, we can help folks because there are no limits with us. You're going to get more services at much, much cheaper prices, and our services will follow you across our nation. So there is every benefit in the world for being with the Ameriplan Corporation. And there are no downsides.
Now, let me ask a question here. Say if I have the ACA and I have a medical issue and I go into the hospital and I'm responsible for my deductible, say, which is $5,000, plus the 30% on top of that. Now, if I have the Ameriplan medical plan, that portion of expense which I am responsible for, can I use the Ameriplan medical plan apply and work with that money that I'm responsible for paying? Can I
Absolutely.
Okay.
It's going to help you in two ways. First, it's going to take the overall bill and get it reduced, and it more than likely will cut that $5,000 deductible, leaving the insurance company with their 70%, and then the remaining costs on the back end, the Ameriplan Corporation, along with the Caris Group, are going to put you on a payment plan. And here's the icing on the cake. You can use the service over and over and over again.
Now, the payment plan, that's kind of interesting. How does that work?
It's going to be based on the member's ability to pay.
And you work that out with your provider?
On your income.
Okay. And that gets worked out through the provider?
That gets worked between the Caris Group and the provider, and Ameriplan and the Caris Group are going to get everybody involved with that particular medical event on one sheet of music, and so everybody knows what's coming in, and it's going to be taken care of. And again, most importantly, if another family member gets sick, it is going to allow you to use the service over and over again. And they're going to take into consideration any previous bills and get them combined, so you're not losing your home, you're not being sued, you don't have to file for medical bankruptcy, which is the number one a bankruptcy issue in this nation.
Yes, I agree with that. Now, Ed, I had a question for you.
Yes.
I have a question. Now, the regular insurance, the Affordable Care Act, is basically traditional health insurance, correct?
Correct.
Now, if you insure your family, each member of the family has a deductible, correct?
Yes, as I understand it, it's like regular insurance.
Right. So everybody, you get two members sick, you could be, I guess, responsible for a big chunk of money to pay deductibles. Now, on the other side, the Ameriplan Health Plan, it is per household, and I understand that there's actually no deductibles and there's no limit to the amount of coverage and I guess discounts you can get through the Ameriplan. How does that work?
Well, how that works is, once again, when I'm running, when I'm out talking with people and these are really the people that do not have any insurance. I tell them right off the bat, I'm not an insurance agent, but I can guide you to where you need to go. But first, I try to introduce them, number one, to our $49.95 health plan, which has our advocacy program in it through the hospitalization that you can call doctors up for $17.50. And the more important thing with those doctor's appointments and so forth, especially hospitalization and that kind of thing, you get that advocate with the CARES group. So when your total bill is $2,500 or more for any family member, they can come in and negotiate your bill with every medical provider you had to deal with during your illness. So that household thing is really a big deal, and I try to talk to these uninsured people in advance, even before they go to the state site, because we'll get them signed up, because it also includes the...
I think we may have lost Ed there for a little bit. Ed, can you still hear us? Bernard, can you kind of take up where Ed left off?
Yes, and I want to add to what Ed was saying with regard to the Affordable Care Act and a household. The Affordable Care Act is per family. If you have extended family in your home, they have to have a separate Affordable Care Act policy for themselves.
Right, because it's traditional insurance.
Right, because it's traditional insurance. And but with us, we're going to help on both sides of the coin, the household and the family, but we want to make sure they understand there's a clear distinction between the two.
Because the Ameriplan is not insurance.
There you go.
Okay, so would you suggest that anybody who is interested in the Ameriplan have a traditional insurance policy as a basis?
I think every household or family needs to have medical coverage, but according to the Affordable Care Act, it is your choice. And there's a penalty this year if you do not have it, but it is not a penalty that will come back and bite you. It is just on your, if you have a refund coming, then they will take that penalty from the refund. They will not hold it against you. And if you don't have a refund, there's no penalty, period. Period, at all.
Okay. And Ed, are you back with us? I think I've still lost Ed again.
Yeah, I can see him, but I can't hear him.
There he is.
I'm here.
Okay. Well, I wanted to ask you a little bit more about how seniors work with the Affordable Care Act. Say if they're not quite ready for, I think, is it Medicare or Medicaid?
Medicare, and
Medicare.
that's usually that gap when people may retire at age 62, but they will not receive Medicare till they're 65.
Right.
So so you usually have a 3-year gap there, and many times our seniors um, they might not have any insurance coverage during that 3 years. At that point, number one. When I was in Arizona just before I left, I had one lady that called me up. She needed some denture work, and she didn't have anything, and people were quoting her, $2,000, $3,000 to get dentures,
Ooh.
and I got her signed up on our 1995 program, and it could save her a considerable amount of money. But with our 49.95 program for seniors who are from 62 to 65, this can serve as a good program, and it all until they get their Medicare insurance at that particular time, especially if they have hospital needs. So there is a 3-year gap between age 62 and 65, where a number of Americans, seniors in particular, who may work with companies that do not provide health care insurance after they retire at age
Ah.
62. They're eligible for Social Security at that point, but that health care issue is getting very, very tough year after year because a lot of the big companies as well as small companies are opting out of these health care insurance because they're so expensive.
Mm-hmm. And then, I don't know if Medicare even covers things like dentures and other dental
No,
work.
they don't. Medicare
Oh,
does not. I can tell you because I'm on Medicare, so uh, that's why I have my AmeriPlan program.
so they don't. If you've got a dental emergency, you can't use your Medicare
No, no.
or need dentures. So
Yeah.
what kind of discounts can you get through the AmeriPlan if you're a senior and you need
Well,
dentures or something like that?
dentures you can get up to 50% off on your dentures.
Okay, and that is it just in a really, did they just use very small numbers of dentists, or is there a pretty good selection, you think?
Well, we have over 75,000 dentists throughout the country, as listed in our brochure.
Hmm.
And I know if you live in the Colorado Springs area, or the Arizona area, LA, or big cities, we have considerable amount of dentists, generalists in particular, who work with seniors and help them to get the best interest possible for themselves, along with implants. Implants are very big these days too.
Hmm.
Uh, we get 15 to 25% off on implants. So that's awful. That's an option too that seniors can get through our AmeriPlan 1995 household dental program.
So Bernard, it sounds to me like that if you know you're going to need some dental work here, which I mean a lot of people do as they get older, that the AmeriPlan would be paid for several times over the cost would be by just the savings on some of that dental work.
Absolutely. And in fact, one use for a senior with the AmeriPlan dental plan will pretty much take care of your monthly fee for an entire year, if not more.
So one
That
incident.
1995 plan covers it all.
So how come more people don't take advantage of this?
Well, and we need to keep getting the word out, keep doing what we're doing now. And I need to also add that Medicare, they tell you up front, they only cover 80% of a bill, and the user is responsible for 20%. Also, if you don't sign up for that prescription plan, then that there's added cost over and above. AmeriPlan fills that gap as well.
So the Medicare has a prescription plan that you need to sign up for?
Oh yes, and you can only do it at specific times.
Ah, and
And this is where people need to be knowledgeable
okay.
and get out and learn. But in any case, AmeriPlan will fill the gap.
So I would assume that that's extra cost as well through
Yes,
Through Medicare. Okay. So let me ask you this. I mean, to me, it just seems like a no-brainer if you're maybe advanced in years a little bit, you got some dental issues, and why would you want to pay full price for your dental procedures and knowing that the insurance company doesn't cover that? So how would you want to get the word out to these folks?
Education is the key word. Advertising, using the internet, doing these sessions here, and one-on-one with different groups. And it is critical that seniors understand that to continue a good life, they need to have good dental care.
Absolutely, and that's a health item as well.
Hey, Dan, if I can add, we're talking
Yeah,
about getting the word out.
sure.
For the last 5 years, 5 years plus, Bernard and I have, here in Colorado Springs area, we have joined with the senior groups, and we're part of their workshop, which will be coming up in October at the Hillside Center. And we're there to serve seniors, and we talk to them about dental care and that sort of thing. So we've been involved with the city and the community, and we'll have a date coming up. I don't know, Bernard might have that date, but I know it's in October that we'll be at the Hillside Center talking to seniors about dental care and some options they may consider.
Well, that's good information. I would think that given the amount of savings involved, and our teeth do deteriorate as we get older, that there's probably almost nobody out there who is past 60 who doesn't need or hasn't had some pretty extensive dental work already.
Yeah, people tend to put off dental care. That seems to be the
Well, who wants to go sit in the chair?
right. But I can assure you, if you go and see your dentist twice a year, you're going to save on your dental. It's like changing the oil in your car, the Fram oil commercial. Pay me now or pay me later.
Yeah, it's going to cost no matter what, and you might
Right.
as well get it done when it's cheaper.
Right.
So
Right.
one thing I was going to add is that the insurance and the healthcare plans, all these topics are pretty complex, and there's just no way to cover every answer in a video like this. Are you available if somebody wanted to call you and discuss this a little bit more in detail?
Absolutely.
How do we get in
Absolutely.
touch? How do we get in touch?
We have a 877 number that is available. They can also contact us by email, and we will address each question or questions for anybody that calls us.
Okay.
And it is listed on our website.
Right. We've got the questionnaire here, and you've got the phone number here, 855-878-7774.
Yeah.
So
Pikes Peak Strategic Group. Pikes Peak Strategic Group.
Yep, PPSG, we've got it, pikespeakstrategicgroup.com. We've got that. So, hey, this has been a good informational meeting here today.
Right.
And I know that this is a complex topic, and we will be discussing this in detail in the future, but I think this is a good way to get the discussion started.
Yes.
Okay.
I agree with you, Dan, because it doesn't whether it's traditional insurance or the non-insurance products that we have. The insurance industry on the whole is very complex. So,
yes.
And every individual has different needs. So what Bernard and I try to do is sit down with the individual and or their family and discuss exactly what's best for them. It's not what's best for us. It's what's best for their family and their needs, period.
And on an individual basis, and you can do that, and I think that's a great service.
I concur.
Well, I appreciate the time here today. I think we covered some big topics real fast, but of course, you're always available at pikespeakstrategicgroup.com for further discussion. Is that true?
And on the 800 number, 855-878-7774.
Gotcha. All right, gentlemen. I appreciate the time here today. Bernard and Ed, thanks, and we look forward to seeing you guys again in a week with some different, maybe more detailed conversations.
More positive education on the whole overall health system, which we all use sooner or later.
Right. Well, thank you. You guys have a great day.
All right. Take care.
Take care.